Carbapenem-resistant Enterobacteriaceae (CRE) were first identified in the late 1990s. Enterobacteriaceae are a large family of bacteria, including common types like E. coli and Klebsiella, that often cause infections in healthcare settings. The emergence of carbapenem resistance in these bacteria posed a significant concern because carbapenems are often used as a last resort treatment for severe infections caused by multi-drug-resistant gram-negative bacteria. The discovery of CRE is part of a larger trend of increasing antibiotic resistance observed in various bacterial species, which is a growing public health concern worldwide. The ability of these bacteria to resist carbapenems, which are among the most potent antibiotics, has limited treatment options for infected patients and underscored the need for ongoing surveillance, research, and development of new antimicrobial strategies. Carbapenem-resistant Enterobacteriaceae (CRE) infections occur mainly through person-to-person contact and are especially prevalent in healthcare settings like hospitals and long-term care facilities. The infection routes include: CRE can survive on surfaces and medical equipment. Infection can occur when patients or healthcare workers touch these contaminated surfaces and then touch their mouth, nose, or an open wound. The bacteria can spread from person to person, particularly through the hands of healthcare workers or between patients in a healthcare setting. CRE infections are often associated with invasive procedures or devices, such as catheters, ventilators, or during surgery. These procedures can provide a pathway for bacteria to enter the body. Many people can be colonized with CRE without showing symptoms. This means the bacteria are present in or on their bodies, but they are not ill. However, they can still spread the bacteria to others, and if the bacteria enter the bloodstream or other normally sterile sites in the body, it can lead to serious infections. Patients with prolonged hospital stays and those who have been treated with antibiotics, especially carbapenems, are at higher risk of acquiring CRE infections. The use of antibiotics can disrupt the normal balance of bacteria in the body, allowing resistant strains like CRE to thrive. The symptoms of infections caused by carbapenem-resistant Enterobacteriaceae (CRE) vary based on the location and severity of the infection. Common symptoms include fever and chills, which are typical in many infections. In urinary tract infections, patients might experience a burning sensation during urination, frequent urge to urinate, and cloudy urine. If the bacteria enter the bloodstream, symptoms can become more severe and include high fever, rapid heartbeat, low blood pressure, and confusion, potentially leading to life-threatening sepsis. In cases of pneumonia caused by CRE, symptoms can include a cough, difficulty breathing, chest pain, and fever. Wound infections may present with redness, swelling, warmth, pain at the infection site, and discharge. Gastrointestinal symptoms like nausea, vomiting, and diarrhea may also occur. The severity of CRE infections is often heightened due to the bacteria's resistance to many antibiotics, making them difficult to treat. Individuals at higher risk for CRE infections typically include those with compromised immune systems, the elderly, and patients in healthcare settings, especially those with prolonged hospital stays or who have undergone invasive procedures. Medical attention should be sought promptly if a CRE infection is suspected, as laboratory tests are necessary to confirm the presence of CRE and to determine the most effective treatment options. Treating infections caused by carbapenem-resistant Enterobacteriaceae (CRE) is challenging due to their resistance to many antibiotics. The treatment often requires tailored antibiotic therapy, where specific, less commonly used antibiotics are chosen based on antibiotic susceptibility testing. Sometimes, a combination of antibiotics is used to improve efficacy and reduce the chances of further resistance development. Careful use of antibiotics is crucial, as inappropriate or excessive use can contribute to resistance. This means antibiotics are used only when necessary, and the choice and duration of therapy are carefully managed. Supportive care is essential for patients with severe infections, which may include hospitalization, intravenous fluids, oxygen therapy, and other supportive measures. In healthcare settings, controlling the spread of CRE involves strict infection control practices, including hand hygiene, use of personal protective equipment, and isolation of infected patients. Research into new antibiotics and treatment strategies is ongoing to find more effective treatments against CRE. In some cases, surgical intervention may be required, especially if the infection involves an abscess or other localized sites. Management of CRE infections requires specialized medical care, often overseen by infectious disease specialists who are familiar with the latest treatment protocols and antibiotic resistance patterns. Early detection and prompt, appropriate treatment are key to improving outcomes.